Sudden sensorineural hearing loss. Overview, definition, esopathogenesis, clinical features, diagnosis, management. Introduction, devastating to patient, frustrating for physician, definitive diagnosis and treatment still unknown. First described by Dr. D. Klein, 1944. Definition. According to National Institute of Deafness and Other Communication Disorder, NIDC, which is National Institute on Deafness and Other Communication Disorder, criteria defined as subjective sensation of hearing impairment in one or both ear developing within 72 hours and a decrease in hearing more than or equal to 30 decibels dB on 3 consecutive frequency in comparison to normal ear on audiometry. Statistics: 15,000 cases reported per year worldwide, 4,000 cases per year in US, limited Indian data available. Estimated annual incidence of SSNHL is 5 to 30 cases per 1 lakh population. Actual incidence may be higher since many patients recover spontaneously. Highest incidence in 50 to 60 years old, lowest incidence 20 to 30 years old. M is equal to W, less than 5% bilateral. A specific cause is in about 10% of patients. Tinnitus occurs in about 80% of patients. Vertigo, indicating an associated peripheral vestibular dysfunction, in about 30%. Up to 80% of patients report a feeling of ear fullness. Onset occur in 72 hours. Recovery rate without treatment 32% to 79%. Usually within 2 weeks of onset, only 36 patients have complete recovery. Etiology: viral and infectious, autoimmune, labyrinthine membrane rupture, vascular, neurologic, neoplastic. Meningococcal meningitis, viral etiology, viral and infectious. Meningococcal meningitis, herpes virus, simplex, zoster, varicella, cytomegalovirus, mumps, human immunodeficiency virus, mycoplasma, cryptococcal meningitis, toxoplasmosis, syphilis, rubella. Etiology: autoimmune, inner ear disease, ulcerative colitis, relapsing polychondritis, lupus erythematosus, polyarteritis nodosa, Cogan syndrome, Wegener's granulomatosis. Traumatic etiology: perilimb fistula, inner ear decompression, sickness, temporal bone fracture, inner ear concussion, otologic surgery, stapedectomy. Surgical complication of non-otologic surgery. Etiology of vascular disease, alteration of microcirculation, vertebrobacillar insufficiency, red blood cell deformability, sickle cell disease, cardiopulmonary bypass. Etiology: vascular. Some evidence suggests that SSNHL loss is associated with both acute and increased long-term risk of stroke. In a prospective series of 364 patients with acute stroke in the posterior circulation, hearing loss occurred in 8%, sometimes preceding the stroke by the several days. Occlusion of the anterior inferior cerebellar artery is associated with vertigo, nystagmus, facial weakness, and gait ataxia in addition to SSNHL.